الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Infant Feeding 2 by Professor Mahmoud Hani Sulaiman. Breastfeeding in special conditions. Low birth weight baby. Breastfeeding in low birth weight baby. Breastfeeding a preterm baby is a special challenge. First few days, it may not be able to suckle expressed breast milk given by nasogastric tube feeding even in kangaroo position. Tube feeding is continued till it reaches 30 to 32 weeks of gestational age. Then, if it cannot suck, it is fed with spoon and a cup. After feeding, it can be returned to kangaroo position again. After 32 weeks of gestational age, babies are usually able to suck. If a low birth weight baby is able to suck, kangaroo position is ideal. Kangaroo position is ideal for breastfeeding. Mother should be encouraged to ensure correct position and attachment. New pregnancy during lactation. So breastfeeding in a when new pregnancy during lactation occurs. Usually the mother stops feeding the child suddenly, which has got an adverse effect on the child. She is advised to continue to feed the child till delivery, and after delivery, she can feed both the children. However, sometimes she may get uterine colic or bleeding per vagina. Under such circumstances, she can stop feeding. A newborn with cleft lip or palate or both. Feeding and breastfeeding in a newborn with cleft lip or palate or both. If there is cleft lip, mother can support the child for feeding by putting her finger over the cleft lip. If there is only cleft palate and not lip, child can be fed in an upright position. If it is only cleft palate, child can be fed in upright position. Therapy, nasal regurgitation is prevented. If there is both cleft lip and cleft palate, mother can feed by expressing milk and fed by cup and spoon. Twin babies, feeding of twin babies, breastfeeding of twin babies. If there are twin babies, both babies can be fed simultaneously in football hold position. If the infant is ill, dribbling nose is occurring, nostrils are blocked, while sucking mouth is also blocked. Nostrils are blocked and while sucking mouth is also blocked, so baby can not breathe properly, so it leaves nipple and cries because of hunger and discomfort. Best thing is to wipe nose with thin cloth. Best thing is to wipe nose with thin cloth before feeding and instill 2 or 3 drops of mother's milk into nostrils. It relieves the nose block and gives relief, and so the baby can suck. Vomiting and diarrhea. Feeding a baby who has vomiting and diarrhea. Some mothers think that during diarrhea in child it should not be breastfed. They do treatment by restricting breastfeeding. This is wrong. Why? Because it predisposes for development of dehydration very soon. So informed mothers not to stop inform mothers not to stop breathing, not to stop breastfeeding, sorry, not to stop breastfeeding during diarrhea, and they must feed baby more frequently. They must feed baby more frequently. Meanwhile, child is treated accordingly. Fever. Febrile child may not suck breast, then it should be fed by expressed milk. If the mother is ill, what she do? What she does for breastfeed? No maternal illness is a contraindication for breastfeeding, except drugs like anti-cancer therapy, lithium, radioactive compounds, and chloromycetin. However, child should be under observation if mother suffering from tuberculosis, HIV, leprosy, diabetes, and hepatitis B. Child should be under observation if mother suffering from TB, HIV, leprosy, diabetes, and hepatitis B. If mother suffering from TB, see flowchart next slide. What you do for management if lactating mother is suffering TB? If the mother and child are in contact, assess growth failure. If there is growth failure, treat it as a case of primary complex category 3. If no growth failure, do PPD test for the baby. If positive, if BCG is given and duration should be more than 15 mm. If BCG not given and duration should be more than 10 mm. So give INH for 3 months. Of course, in the dose of a baby. If PPD test negative, if BCG is given, it must be less than 15 mm. If BCG not given, less than 10 mm. So if BCG given, stop INH. If BCG not given, stop INH and give BCG. This is the management if lactating mother suffering TB. If the mother is HIV positive, this is described under epidemiology of HIV and AIDS. If the mother is hepatitis B positive, the newborn has to be immunized with hepatitis B vaccine, as we said many times, actively and passively, followed by rapid schedule. However, breastfeeding has to be continued as usual. Breastfeeding has to be continued as usual. Relactation. It means re-establishment of lactation in a mother who stopped nursing temporarily due to major illness or surgery. Reflexes start functioning when the child is put to the breast. Induced lactation equals establishment of breastfeeding in a woman who has never been pregnant. Such circumstances occur when couple adopt a child and woman wants to develop motherhood. After all, what is required for establishment of breastfeeding is stimulation of reflexes. Since child does not get milk, it may not suck, so mother should use nursing supplemental. Figure is next slide. It consists of a bottle of milk with a thin long straw, for example scalp vein drip set, brought near nipple alongside breast. When baby sucks, it gets milk from bottle and so continues to suck, thinking it gets milk from the mother. Thus, reflexes are stimulated, and in due course of time, milk production is established. Nursing supplemental can also be used for relactation. This is baby feeding from the breast and using a nursing supplementer. If the mother is employed, a working woman, this is important for occupational medicine. She must apply all her leaves, and practice exclusive breastfeeding up to first 6 months. If not possible, she must feed child before going to work, then collect expressed milk in a clean cup with an instruction to attendant to feed intermittently, and she must feed child as soon as she returns from work. She must feed more frequently during night times. If crèches are established, she can come and feed during nursing breaks. Under no circumstances, the working women should prefer bottle feeding. She must also do breastfeeding. Weaning. What is the meaning of weaning? It is timely complementary feeding. It means process of withdrawal of a child from breast milk to external foods. This is done gradually, so child adjusted to external foods. Complementary feeding started from sixth month onward due to mother's milk alone is not sufficient for growth. So from 6 months, mother's milk alone is not sufficient for growth and development of child. Suitable foods added to breastfeeding, soft foods rich in nutrients. It is called supplementary foods. Weaning period is the most crucial period. If early, it will lead to child gets infection, and if late, it will lead to child develops malnutrition. So complementary feeding should be done properly. To start with, supplementary food should consist of liquid foods like fruit juice, vegetable soup, cow's milk, etc. Later followed by semi-solid foods like soft cooked rice, smashed vegetables, soft fruits like banana, soft boiled egg, mahalabiya, and so on. These items are given one at a time. When child is used to one item, another is started. If it does not accept, it is not forced. By 1 year, child will be able to eat all foods the adult eats. However, breastfeeding must continue at least up to 2 years. Bottle feeding must be strictly discouraged because it predisposes for alimentary infections resulting in diarrhea and for respiratory diseases. Dangers of artificial feeding in the child: infections, malnutrition, allergy, risk of chronic diseases, obesity, low intelligent quotient. In the mother, frequent pregnancy, risk of anemia, ovarian and breast cancer. Demand feeding equal breastfeeding child whenever it demands and as long as it demands. No restrictions on frequency and duration of breastfeeding. Child is fed till it is satisfied. Satisfied means baby allowed to breastfeed unrestrictedly. Sudden stoppage or premature termination of feeding often affects growth, development, and behavior of a child. Feeding by time, once in 2 to 3 hours, schedule feeding only for few minutes and offering only one breast each time is a malpractice. Feeding by time is a malpractice. Alternate breasts should be offered at each feed. one breast must be emptied out fully before second is offered so that baby receives both for milk rich in proteins, sugar, vitamins, and minerals, and hind milk rich in fat and satisfies baby's hunger. Advantage of demand feeding: breast milk comes in sooner, babies gain weight faster, prevents engorgement of breastfeeding is established more easily. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.